Good morning, everybody. Happy Thursday, and welcome to another episode of MedWell Unscripted. We're really excited. We're the start of October, which is Breast Cancer Awareness Month. And today our topic is how medical marijuana helps to ease cancer treatment side effects. So it's a very timely topic. We're really excited because we have a special guest, Mikayla Bell, who is the outreach coordinator and Medicare manager from Netis. And we also have our infamous Emily Waxman, our director of community outreach. And I just want to acknowledge Kayla is from MedWell, and she's our team member who manages our chat and does an awesome job for us each week. So we're glad she's here. And my name is April. So just some housekeeping, friends. Please do ask questions in the chat. We will make sure that we get to each and every one of them. If you are catching the replay today, feel free to leave comments after, and we will absolutely answer your questions. So let's get started, ladies. Emily, I'm going to start with you and tell everybody what you do for MedWell and your role as the Director of Community Outreach.
Absolutely. So again, welcome everyone. So excited to have Mikayla here today. But again, my name's Emily Waxman. I'm the outreach director here at MedWell. I get the amazing opportunity to be able to go out into the community, to be able to talk to all sorts of folks, whether they be at the dispensaries, patients, non-patients, to be able to explain the medical program here in Massachusetts, let them know all the wonderful benefits of being a medical patient here, as well as talk to, just all the organizations out there that can help get people the medicine that they need. And, I just love what I do. So basically, in a nutshell, that's where I'm at. And I'll let Mikayla introduce herself.
Awesome.
Well, thank you so much. I'm so excited to be here with the MedWell team today. Thanks again for tuning in. My name is Mikayla. I'm the Community Outreach and Medicare's manager. And essentially what my role is focus on educating. We know that cannabis is still new for a lot of people, and to make them feel comfortable and confident and actually be able to consume it in a safe manner is the pivotal point of my job. And then I also focus on philanthropy and outreach in the community. So I partner oftentimes with charitable organizations in Brookline, Northampton, Franklin, and beyond to connect them, whether it's volunteerism, donation-driven drives, and beyond. So very much community focused and education at the forefront.
Amazing.
Awesome. So today's conversation, we're going to, talk about cancer patients getting relief from cannabis. And I think one of the things, is that I speak from my own personal story. My husband had cancer, knock on wood, 20 years cancer-free. And at that time, this wasn't even a resource, right? So lots of things have changed. And of course, there was ability to access marijuana, but not legally. And I know when he was really in the heart of his chemo treatment, his stomach, he was very ill. It was, he really could have used something where he was using medical marijuana to ease some of those symptoms. So let's talk a little bit about kind of, the patient experience. If you have a cancer patient that comes in, and how do you help them? And is there specific strains that are better than other? What types of symptoms does it relieve?
Oh, yeah. So, what's really great and what I'm proud to talk about is that Netis has quite an extensive selection of products. Our goal is really to aim to have something for everyone, whether you want to inhale, whether you don't want to inhale, whether you want something that's high potency THC or something that's non-psychotropic CBD dominant, and everything in between. And so really it comes down to what type of experience the patient really wants to have. Mm-hmm. At the beginning, before we even start anything, the motto is low and slow, always, especially when trying a new medicine such as cannabis. For a lot of people, they might have not tried it before. So having the smallest dose possible to achieve your desired effects is always where we start. And typically, we'll guide people towards, we have tinctures that are really excellent. They're a sublingual treatment. You put a few drops under your tongue, and typically that will onset between 20 and 30 minutes. So sometimes, patients with nausea, or they want a boost of euphoria, for example, they have sativa options. Sometimes for pain relief or some insomnia, indica tinctures tend to be the path that we'll take. And we do have some tinctures that are reserved exclusively for patients, which is a really great benefit. And actually one that, sometimes is the unsung hero that I love to talk about, especially with patients that have treatments that maybe don't want the psychotropic effects, is THCA. It's this cannabinoid that's less known, but is starting to come into the limelight. And that's the acidic form of THC. So we do a mini science lesson. You have THCA in all of your cannabis plants. And when it combusts, that's when it undergoes the chemical reaction to become delta-9 THC, which is what causes you that high effect. So what's great about THCA is you can get some nausea relief, some overall anxiety relief. In my personal experience, I find that it almost, feels like a CBD product, but it has that THC component in it. And oftentimes there are traces of CBG in it, which is also non-psychotropic and can help with nausea. So especially where, I had one of my aunts was diagnosed with breast cancer. One product that seemed to be really effective was that THCA didn't cause her to feel hazy or high or out of control, but it was able to ease some of that nausea. And it's actually a product I don't really leave home without at this point. If you get just a little, stomach ache or something like that, but you still need to be functional, you're still going to work, you have kids, this, that, and the other thing. It's a product that can keep you with it, so to speak, but also, relieve some of your effects. And then we have edibles. Edibles seem to be a great product, especially for those, again, that might have restrictions for inhaling. I know that depending on where people live, if they're in an apartment, if they're under certain housing restrictions, they might not be able to actually smoke or even vaporize. So edibles are a really great discreet way, and they have long-lasting effects, which is really great. So especially those that might have some pain or nausea and are having trouble sleeping. I mean, just general anxiety about cancer, is a huge symptom that oftentimes might be pushed to the wayside because you're dealing with nausea. Oh, I got to get to my next appointment. Well, I can't sleep at night. Well, I'm in pain. So I find that edibles can be helpful in small doses, of course, again, low and slow when you try edibles, but they can oftentimes last between 6 to 8 hours. So especially if you're trying to get a great night's sleep, or if you want to take just a tiny bit in the morning to have a lasting effect throughout the day without having to re-up potentially, that's always an option. We also have topicals, which are really great. It might not be the focus of a lot of cancer treatments, but especially for those that have localized pain. We have a lotion and a salve. It's a 1-to-1 ratio, so it's an equal ratio of THC and CBD. We actually, at one point, we had a lotion that was pure THC and pure CBD and the 1-to-1 ratio. And, we really do rely on our patient feedback, and the 1-to-1 ratio just really seemed to be the most effective all around. And I really think it attributes to having both cannabinoids present, the THC to help with some of the pain relief and the CBD to help with some of the inflammation. So, and then, vaporizers and flower.
So when I guess one of the questions that I have is when a patient comes in and so they're on chemo, or how does kind of that work in determining, if they're on chemo? And of course, like I remember my husband, he had so many medications. So like, how does that, there's lots of questions because like anxiety, right? So typically they give a prescription for Ativan, things like that. So how do you guys work with those type of things when a patient comes in, which I would imagine they may share their medication list because of course we're at privacy and that, everything's under HIPAA. But how does that work? Or does that even happen?
So it does happen, and this is where it gets a little tricky in the dispensary world. It's just that we're not medical doctors. We can't actually give precise medical advice. And a lot of times we do rely on the doctor-patient relationship and to be upfront and honest. So that's why, seeing a doctor or a nurse practitioner and feeling comfortable with them, which is the feelings that I get with MedWell, having that open and honest relationship, a totally non-judgmental zone to express the drug interactions that might happen. Because as I've attended a few conferences, it's actually coming out more that CBD might have some more intensive interactions with some of the prescriptions being administered maybe over THC products. So, if someone did come in, we would try to guide them as best as we could with their symptoms that they're going through and pair them with some of our products. But at the end of the day, too, we would still advise them to connect with their doctor just to be sure that, they really have all their ducks in a line. And typically, it's funny because we almost get two different types of patients when they come to the dispensary. We get one that has the grocery list. This doctor told me to take a cube in the morning and 2 drops of tincture at the end of the day, and they have the very specific list.
Sure.
Easy, check, 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 and we're all, you're on your way. Some of them have a little more flexibility. So it'll be, okay, during the day, you're going to want to take a CBD product. At the end of the day, you're going to want to take an indica product. So that's where we can kind of have a broader selection and go, okay, so an indica product. Are you looking to inhale? Are you looking to have an edible? Are you looking to have, a tincture, something sublingual? And that's where we can kind of pair them to what was prescribed by the doctor.
Yeah. And you know what, April, I'll just make mention too on what Mikayla just said. I have the wonderful opportunity to be able to talk to a lot of our patients and book their appointments. And Mikayla's exactly right. You get different sorts of individuals that, either they've got their whole list of medications. And many times what I'll do is I'll be able to get that directly to the doctor that they will be meeting with or a nurse practitioner so that they will see exactly what is going on in this patient's world, what they're taking. And then, there are those patients as well that are a little bit more laid back. They have just their generalized list of what's going on. But either way, whatever it is, we will work with them. The nurse practitioner and doctors here at MedWell are very knowledgeable as far as those interactions, what would happen. And they're always happy to recommend and, give them as much or as little as they're looking for. And, they can take that knowledge right over to Neta and be able to, speak to all the knowledgeable staff over there that can assist them even further.
All right, we have a question, and actually, I'm sorry, it's going to cover you up a little bit here, Mikayla. We have a friend on YouTube. Good morning. Suffering from pancreatic cancer. What can I use for body pain throughout the day, but still be alert to enjoy life? Have heard of RSO, but I don't see it in med stores. Does strain matter?
So I think that strain absolutely does matter because every strain that exists provides a unique effect. So that's where it can be tricky in the beginning. And a lot of times it is trial and error. So I always advise patients to document their experience, especially, keep it on your phone, keep it in a notebook, just write down some notes about how you were feeling or, what was going on. Typically, I would say if you're looking for a more body relief, but you don't want to necessarily be sleeping, I might avoid the heavier indica strains. We actually joke that it's indica couch because they're very sedative. They're more body relaxation, more nighttime. I would advise a patient maybe to try an indica if they were going to sleep and they were experiencing pain because they are going to be pretty much knocked out. Mm-hmm. But there are hybrid strains, and that's where I think it gets, this is where the trial and error comes in, but I think this is the general category that might be helpful because hybrids are pretty much even Stevens. It kind of gives you're not necessarily too high, you're not too active or energized, but you're not necessarily going to sleep either. They're typically known as social strains. So you get some of the benefits of each of the sides. You might get some of the body relaxation from the indica side, but you're still going to be a little awake from the sativa side. And also some of the hybrid strains can be leaning. So depending on what the strains are crossed with, it could actually have a more indica leaning effect. So you might get a hybrid indica leaning, which will still keep you pretty lively, but it has more traits of the indica strain, which will give you that body relaxation feeling. So I would tend to look for strains that are more indica hybrid, for the alert, but relaxed body sensation. And that's where maybe even edibles come into effect. We have these cubes that are 5 milligrams each. So they're very, very low dose. And you can even cut them in half. And they come in all varieties: sativa, hybrid, indica, CBD, and 1-to-1. And actually, a 1-to-1 might be your best bet. We've had a lot of patients really talk about their success with 1-to-1 edibles, because it does keep them alert, but the mixture of THC and CBD kind of helps with any inflammation or pain that's going on. So that might be where I would start you, especially if you wanted, A, it's long-term, 6 to 8 hours, which is great. And 2, you're not necessarily going to be knocked out from a 1-to-1. But again, try it in a small enough dose that you can document it and really learn about what you're experiencing. And then you can always increase your dose as you get more comfortable.
That's great. And I just kind of some follow up to that. Everybody does have different types of cancer, right? So like you really have to, I'm sure you have to kind of walk through where their cancer lies and where they're fighting to determine what type of product might be a good fit.
Exactly. Because I think a lot of times, sometimes people come in and say, I have this cancer, what's going to cure it, basically? And it's hard to say anything will cure it at this point, but we can work on what you're going through symptomatically: the nausea, the anxiety, the sleep, any pain, anything like that. We can help to pair you to a product that might be able to assist you. And patients are constantly giving us feedback. We really hold on to that anecdotal evidence. I mean, it's so powerful. And so oftentimes, if we get a large group of patients saying that they felt a certain way, okay, cool. So that's what, this group of patients, and again, everyone's unique. How I, react to a strain might be totally different from how you react to a strain, but at least we can have a good baseline to where to start.
Right. So he also referenced RSO, so Rick's Simpson Oil. It seems like the availability is less right now. Do you have anything to add to that? And kind of because he was actually, and I'm sorry, I can't tell if it's a he or a she because of your username, and that's what I see on YouTube. So I apologize in advance. But I think the question comes from, there's a lot of information online about Rick Simpson Oil and all the great benefits from it, but I definitely, maybe you can talk a little bit more about what it is and the availability of how people can actually get that product.
Absolutely. Yeah. So RSO is super powerful, and it's definitely been widely known, especially in the cancer world, to be effective in treatments. And some patients have even come back and said that it's reduced the size of their tumors and reduced the mass of their cancer, which has been really great to see and hear. It's something that, unfortunately, I haven't seen a lot of dispensaries actually create it or carry it in store, but there are vendors that exist out there. There are caregivers that do carry it. And there are, there are certain, I guess, outlets to access it. It's just something that I think, dispensaries haven't necessarily gotten on board with just yet. And unfortunately, it's just something that we haven't carried yet. So usually we'll try to pair people with, the products that we have available.
Sure. So can you tell everybody a little bit about kind of the types of appointments that you offer at Netis? Do you do like the initial consultation, right, where they're having that patient experience, and then do you also do delivery? Like, what's the best way? Because obviously, if a cancer patient is really not feeling well, they might not want to come in, and also we have this overlying COVID thing still happening in our world. So, and they're very at risk. So how does that work?
Oh, yeah, definitely. So right now, just due to everything that's happening with COVID, both of our stores, so we have a location in Brookline and then we have a location in Northampton. Both of them are operating under a reserve ahead model for right now.
Right.
So basically, you order online ahead of time, and you pick a selected pickup window, and then you show up, then you pick up your order and you're on your way. So it's a very quick transaction, and we can only have a certain amount of people in the store at a certain time. So It works out nice. But in the event that a physical in-store visit is just completely out of the question, we also do offer delivery both in the greater Northampton, Western Mass area, and we just expanded to Salem, Mass today. So in Brookline, we deliver all over the place. It is really just impressive with how quickly our delivery radius could expand. So we really are trying to reach as many patients as we can. And those deliveries take place on Tuesdays, Thursdays, and Saturdays. So if you go to medicare.org/delivery, you can type in your address and see if we're able to deliver to you. And then you can place your order. And usually ordering ahead is the best way, because then you get in our schedule and we're able to come to you. And then we also in Northampton have curbside pickup for patients. So that's also an option in case you want to. You can go physically, but you don't want to go outside. You can stay right in your car and our staff will bring your order to you and do the whole transaction right then and there. So that's really great. And then another piece that I like to remind people of too is being a medical patient, you can assign 2 caregivers to go on your behalf, which has been so beneficial. You know, I was a caregiver for my mom at one point. You know, my boyfriend is the caregiver for me for the days that, you know, sometimes you just don't feel good, you know, and it's always just so good to know that you can rely on 2 people that can go on your behalf. You know, it's all tracked under your profile, but you know, you do have that option. So yeah, there's a multitude of different options for patients, especially if they want to shop at Neta. You know, they can do reserve ahead, they can do curbside pickup in Northampton, delivery basically all over. I think Western or Central Mass is like the only area that we're really not reaching at this point. And then they can also assign 2 caregivers to visit us.
And so how does that process work? How, you know, is that on when they're meeting with the doctor that they assign it? Or is that when they get to the dispensary? Just to clarify for people that are considering adding a caregiver.
So I can even mention that a little bit, April. So what happens is once a patient is approved and they certified, the caregiver is assigned during the registration process with the state. So they get their own card with their information. They have to supply almost similar information as what the patient has to. So they have to show a mass ID of some kind, you know, a driver's license or state ID, the last 4 of their social, and, you know, they will get their card on behalf of that patient so that they can go into the dispensary and purchase on their behalf. And it's a pretty simple process. We at MedWell like to make sure that we make that very easy for folks. So if there's ever any issue where they're having with the registration piece or, you know, they need some help, we make sure that our registration department makes sure that that is done and is simplified, and the caregiver will get their card in the mail just like the patient does.
And is there an additional fee for it for the caregivers?
No fee.
That's actually a really great option.
Yeah, it's fantastic.
All righty. So let's kind of talk a little bit about Medicares. You guys do some great things in the community. And as you mentioned when you started and kind of your role as education, and we love education at MedWell. So tell us a little bit about Medicares and some of the projects you're doing in the community and all of that good stuff.
Oh yeah, no, I love talking about Medicares because it just, the group is just so active and it's just so willing to try new things and really expand and try to reach as many people as possible. So some of the things that we've done, both in Western and Eastern Mass, we pair up a lot of times with homeless shelters or women's shelters, and typically we'll run drives for them. So right now out in Western Mass, we have a drive going on for the Amherst Survival Center. And basically they're collecting a multitude of most needed items. And what's great for patients is that when you donate an item, you get a 10% off coupon. So it is one coupon per patient per drive, but you do get to stack those on top of if you have a financial hardship discount or other discounts. So it is 10%, and typically patients will wait till they kind of stock up and then they can use that. And then in Brookline, we're going to be starting a canned food and healthy food drive for the Brookline Food Pantry. And what's really interesting about the food pantry, especially at this time, is that they also were running the weekend backpack program. So it actually worked to feed kids that didn't have access to meals without school. And especially now in the community where school is kind of all over the place and some are in attendance, some are virtual, this becomes even more important. So a lot of residents in Brookline and the greater, Brookline area are really relying on the food bank. But other things that we've done, so another piece that's kind of fun and an extension of Medicare's is we have a green team in Brookline, and we just started green team in Franklin. And what this team does is once a week, we walk around the neighborhood and pick up trash and dispose of it, because in Brookline, we acknowledge that, there's a lot of people walking around and there's a lot of foot traffic, and especially being on, Route 9, that highway gets so busy with just regular traffic. So, hey, we're in the area. We want to give back and show that we're, good neighbors. And so, yeah, we go out once a week, and the team, I've never seen so many enthusiastic people to go out and clean trash. I mean, I actually have to tell people, no, we already have enough people. Like,
that's great.
You see this really dirty highway and you're like, well, we're going to clean it up. This is going to be on us. And to see the finished piece, it really motivates people week after week. And in Franklin, we walk around typically the Forge Park area, which I didn't know what to expect trash-wise, and it is really, it's been eye-opening just because of how many trucks drive by, and it's a main road, and
wow, yeah.
And small ways that we can give back to the community. In the beginning of the year, pre-COVID, we actually we made Valentine's Day cards, and we gave them to the seniors living at assisted living homes.
It's great.
Things like that. We partnered with, some of the community mental health centers, just as volunteers. They needed help setting up an event, and you know what? Let us be the grunts. We're happy to do that, and especially to make an event as powerful, and as educational as mental health. Any way that we could, help them put that on, that's what we want to do. So a bunch of different things. We've partnered with Children's Hospital for toys drives. Our biggest partnership was recently with Brigham and Women's Hospital. So, partnering with them and donating, charitable expenses essentially, and partnering with them for some of their charity events. So all in all, it's just been really, really great to just see how much, our team is able to participate in. And it's come a long way. I've been doing this. So I've actually been at Neta for 5 years now. And I remember in the beginning, there was a lot of pushback. It's cannabis. There's a stigma. And a lot of organizations were really hesitant to partner with us because they just didn't know what to expect. And oftentimes some are hesitant because they have federal funding. They can't accept our cannabis money.
Right.
So it does provide some challenges. And I'm excited to say that, we've been able to partner in creative ways. Maybe it's not a money thing, but they need physical hands, so we can be there to physically help them and partner and show that we can be helpful and professional and, defeat that stigma. And since, 5 years ago, it is really grown. And we have been able to work with so many more people. So it's really come a long way, which has been great. And we'll continue to do what we do.
Awesome. And so as the program manager for Medicare, tell us a little bit about your role there and what you do to make all the magic of giving back happen.
Yeah. So it definitely strategic because we have 3 locations. So making sure that there's something for everyone in all 3 of their locations. So with COVID, the plans kind of got pushed to the wayside. It was really difficult. Even partnering, for the weekend backpack program, they wanted just the core volunteers because, again, any more extra exposure, they just didn't want to risk it, especially with kids. You just don't want to have anything happen. So for me, how I kind of plan things is one, we want the hands-on volunteer opportunities. Our employees love that. And it gives them volunteer hours that they can be proud of. So we always aim to have hands-on volunteer opportunities.
Sure.
Then we typically will run a drive once a quarter, and we'll run it for the duration of the quarter. So out in Northampton, actually kind of my counterpart out there, Leslie Laurie, is in charge of all the Western Mass drives that they do out there. So they've partnered with their survival centers, the Food Bank of Western Mass. They actually were unloading truckloads at one point. It was wild to see how many donations out there. And they were really able to reach such a large, half these, centers serve entire counties. So, our patients really got into it, which was exciting. And then, of course, we do get requests for financial donations. So those are always taken into consideration based on what the budget looks like for the year. But those are basically the 3 buckets: is hands-on, actual donations, and then drives in store.
And Mikayla, I'll just make mention too that, I just really want to tell our friends out there, if they want any information, they can always go to the Neta website. Your website is just, it is just Amazing, amazing. Just so great for, anyone that is a patient or looking to become a patient. How fantastic that they can go, not only to see all the amazing things that Netta does, like you mentioned, there's beautiful pictures of all the things that you've participated in, but I mean, just between your patient handbook that you have there, as well as it's so easy to maneuver through it, to see what is available there. Just even going down to placing the order, it's seamless and so easy. And I just suggest to anyone watching that they go and take a look at it, because it really is just a wealth of information and it's really beautifully done. So I just wanted to make mention that, when you touched upon just some of the pieces of, all the wonderful things that you do, there really is some great stories there, beautiful pictures, and it's nice to see. So I wanted to mention that.
Thank you. That means a lot. It took a lot of work to get that up, but
yeah, no, it's beautiful and a great resource.
Yeah.
So what has been your favorite project that you've done? I know I can tell that you're passionate about all the ones that you've been involved with, but do you have one that stands out where you could share a little bit of a story of what sticks in your mind about that one project that you did in helping others?
Oh, I definitely do. This has been, I don't know if I'll ever have anything that tops this, to be honest. And this is setting this.
Are you going to make us cry? I feel like you're going to make us cry. I don't know.
I can't say the group that I had partnered with because of HIPAA, but I did partner with an assisted living home in the greater Boston area. And they were really enthusiastic. A lot of the residents there were really excited to learn about cannabis. And I love that. That was my favorite thing, is going to assisted living homes or senior centers. And they have them probably outsmoked me back in the day, which is always amazing. Now, I always try to break the, all right, who's tried it? And, you see some that are nervous and you see some that say, oh, honey, please. I know. But I had this one group and they were really enthusiastic, and they organized frequent bus outings. So they would bus the seniors to a movie, or they'd bus them to restaurants, or they'd bus them all over. So the director reached out and said, what if I bus them to Netta? And I was like, I will coordinate everything. It'll be amazing. And then she messaged me later and she goes, well, would you be able to come on the bus and consult with them on the way? I joined the bus with 6 or 7 women who were all 80 and above, and I did speed dating style consultations on the bus from their center to Netta, and then loaded them off, picked up their order. We all took a group picture to commemorate the occasion.
Yes.
Loaded them back on the bus and brought them back home, and continued to answer any questions. It's funny, actually, I had to tell them to wait because one of them was really excited and she wanted to try it right then and there. And I'm like, okay, that's all now kind of easy. And it's funny because, 9 times out of 10, especially with elderly or anyone that's in the geriatric group, it's lotion, CBD, 1-to-1, very low and slow. You're going to do a drop and see how you feel. This one, by the time I got to my last patient, she goes, listen, you told all of them how to not get high. How do I feel a little something, something? I'm like, oh, all right, we can get you feeling a little something, something.
I can only hope that I'm not frisky.
That is excellent.
Oh, yeah. I mean, our detail officers in Brookline just were cracking up because I hopped off the bus and they're like, what's going on, Mikayla? I'm like, what do you mean? And it was all of them unloading. They're like, this, we should have had this on video recording. How it's so, again, it's a little, the unsuspected group of patients that do come through, but our average patient age is 47 years old. I mean, it's a lot of my parents and then their parents, coming through. And, I even brought my dad, who is, it's funny, love my dad, but he's very
totally aging us right now, Mikayla. Emily, did you think that when she said that? I was like, oh, like we are them.
Like cool parents, okay. I brought my dad, who's very, he's always been involved in like labs and very pharmaceutical based, very chemist, this will help this and very exact. And, he's always been open-minded, but, a little reserved about cannabis. And so one day I brought him in for a tour and I'm like, Dad, just come in and see who we serve. This is back when, again, it was all walk-in, everyone was in the building. And I brought him up to our balcony in Brooklyn and he just looks down. He's just like, I would have never thought all these people would be here. Like half these people look like people I'll see at work tomorrow, like people that I work with, just norm. I'm like, it gathers everyone, young, old, in between, and all different backgrounds. And I think that's the beauty of it. It really brings together so many people from all different walks of life.
Absolutely.
Really just being able to experience that and then show him and kind of have his perception change a little bit about it. It's really, really something else. So
yeah, absolutely.
Oh yeah.
So true. That's great.
All righty. Well, wow, Mikayla, thank you so much for sharing about Netta and sharing about Netta Cares and all that you guys are doing in the community. And for our friends out there, please do continue to leave comments and ask any questions you have. And again, we are at the start of Breast Cancer Awareness Month. Go out and get checked, get your screening, take care of yourself. Self-love and self-care, it could be one of the most important screenings that you do. And for all of your medical marijuana certification needs, or if you just want to learn more, we have lots of blogs available at medwellhealth.net. Please do stop by our website and catch us in 2 weeks. Actually, I'm sorry, we actually have a great Q&A next Wednesday evening at 7 p.m. We're doing a Q&A about vaping and kind of answering all your questions on vaping. So come back and join us then, and we'll have another MedWell Unscripted in 2 weeks from today. So thank you, ladies, so much for all of your time today and all of your smarts and sharing with us. And it's been great.
Mikayla, thank you.
Yeah.
Thank you so much.
Thank you so much for having me. This is awesome. I'm so appreciative that you kept me in mind and invited me.
Thank you.
Yeah. Thank you for all that you guys are doing to make a difference in the community. And I can't wait to hear more stories about your field trips that you take.
Oh, yeah.
All right, friends, have a great day and we'll see you soon.